Hi, everyone. Welcome to Joy in Dementia. My name is Laura Smothers Chu, and I am the CEO and founder of Befriended Heart, where I help daughters navigate their parents' dementia. And these daughters are long distance daughters like me, and they are also providing the caregiving support. So they're not the caregiver that lives with the parent with dementia, but they provide some backup support. And I think that it's a really good opportunity for the daughters to work with their caregiving parents. And so I have a really great guest expert with me today. She is going to address the issue of end of life care. So I think this is something that we as caregiving daughters know a little bit about. And I know I never really knew the difference between palliative care and hospice care and when is a good time to bring that in for my parent with dementia. So my dad is in the probably mid to later stages, more on the later stages now, of dementia. And so these are some things that I'm likely going to be keeping in mind for my situation, but I wanted to share those with you. So I wanted to introduce Heather Suri. She is a geriatric care manager at Pathways in Aging, which is based in Centerville, Virginia. And Heather is a really compassionate nurse with several years working in both hospice and palliative care. So she is a great person to talk about the difference between the two. And Heather and I both work as advocates for people with dementia and their caregivers, and we've created a really strong friendship from that. So, Heather, welcome to Joy in Dementia. It's great to have you here.
Laura, thank you so much for inviting me to talk with you today. I really appreciate the work that you are doing for daughters and supporting their parents who are struggling with this diagnosis.
Thank you. Thank you. You too. Can you tell us a little bit about yourself and your expertise? I know I introduced you as a geriatric care manager, but I think you're going by aging life care manager now.
Yeah, I'm a member of the Aging Life Care Association, which is a professional organization for care managers. And really using that term aging life care manager encompasses the kind of breadth of work that we do with people throughout the lifespan. But certainly my area of specialty is working with the geriatric community. I've been a nurse 21 years. I've always worked in community based nursing. I love working in people's homes or the places they call home. So, whether it's long term care or home health, home care, and then, of course, the work that I've done in hospice and palliative care. My favorite kind of nursing is one I can do in people's homes.
That's awesome. I love you say the place that they call home too. That's really great. And can you talk a little bit about your credentials? I know that you said that you're definitely a registered nurse, and I think there was a couple of other initials after that.
Yeah. So I am a nurse. I'm a bachelor's prepared nurse. I also am a certified care manager, um, which allows me to practice as an advanced professional with the Aging Life Care Association. So that just says that I've got the educational, the supervised professional experience, and I have passed credentialing exams that have shown that I'm prepared to do this work.
Yeah, that's awesome. I talk to my audience here on my channel about how important it is to hire someone who has credentials because it shows that they have that extra education that's necessary for this field, in my opinion. So, do you have, you talked about your professional experience. Do you have personal experience with dementia or as being a caregiver?
I do. Both of my grandmothers had dementia diagnoses. My mother's mother actually died from dementia. And my father's mother is living with dementia now. And I am a secondary caregiver for her. I'm her power of attorney. I coordinate her care from a distance. She lives in Washington State. So it is very personal um, to me when we've gone through relocation with my grandmother. Um, we she has she's an alcoholic with dementia, and the challenges that exist there, and the ethical questions that come around safety and autonomy and choice.
I think that's a really hard thing that we have as daughters, who are secondary caregivers, is the balance between safety and autonomy, because we want our parents to, or in your case, your grandmothers, to have that independence and that dignity. But
Mhm.
we also have concerns, especially being in the field that we are and knowing about falls that can happen, really trying to get that balance. So Heather, you talked about your personal experience with dementia. How do you feel like that shaped your career?
I think that I have always had a heart for people who were vulnerable and families that were struggling. Um, Certainly, the type of work that I chose to do through nursing school revolved around elders and elders with dementia. Um, there was one woman that I helped provide care for as a nursing student, and ultimately, years down the road, I became her power of attorney and helped care for her through end of life, help manage her care. So I think I've always seen that need for advocacy and families' need for support. So it's just always been work that I've loved.
What an amazing story that, you created such a strong bond with someone as, when you were a nursing student. That's really special. We hear about palliative care and we hear about hospice care, and they're kind of used interchangeably. So, since
Right.
you've worked in both, I was wondering if you could kind of define, each word and compare them for us.
Sure. So, palliative care is an approach to care. Um, Hospice falls under a palliative umbrella. It is, essentially what palliative care is an approach to care that focuses on relieving suffering, focuses on quality of life, and reducing the stress, the caregiving burden on those primary caregivers. Um, Hospice care is a palliative care approach. In hospice care, we are focusing on quality of life. We are focusing on relieving suffering, on treating symptoms of discomfort. However, hospice care, it has a clearly defined time in the lifespan. We consider someone to be appropriate for hospice care when they have about a 6 month prognosis. So we really are looking at, in general, those last months of life. Palliative care, I believe, is an approach that can start really with a life limiting diagnosis. It's a shift in thinking. Um, you can still pursue curative treatments under that palliative care umbrella, where that might not be appropriate under a hospice care situation. So, again, if we're just focusing on quality of life, all of our decisions are made with that in mind in palliative care.
So, Heather, when you talk about a life limiting diagnosis, would that be like if someone was to, in the case of my dad, he was diagnosed by a neuropsychologist that he had mild cognitive impairment? So, I know, MCI can kind of go either way, but there's
Right.
a high chance that it could turn into dementia. So, would that be considered like a life limiting diagnosis?
I don't know if MCI would be considered a life limiting diagnosis, but because we know what we know, and we do know that a certain percentage of people who are diagnosed with MCI will
Mhm.
progress into dementia. I believe that advanced care planning is for everyone, but it's particularly for it becomes pertinent when you've received a diagnosis that indicates that your cognition is changing, um, and so it's important to start making those decisions. And those will help shape what your palliative care will look like as the disease progresses.
Yeah, that makes sense. And so you talked about palliative care as an approach. So basically, when there is a diagnosis of, it's kind of up to you when you want to start the approach. I don't think there are any downsides to a palliative care approach, just because it is lessening suffering and increasing
Yes.
happiness, which is like, why would you not want that? But I think dementia is especially hard just because, as far as talking about hospice, you don't really know when the 6 month time is up. You know what I mean? I think that's the really hard thing about dealing with dementia is that it's so unpredictable, and there can be regressions and progressions, and you never really know when. So like when, I guess, can you tell us when is a good time, like for hospice, like especially if the doctor is not necessarily giving you a 6 month prognosis?
Sure, sure. So, in terms of hospice criteria, you're right. With a congestive heart failure diagnosis or a COPD diagnosis or a cancer diagnosis, the eligibility criteria is much more clear cut. With dementia, it's a little more slippery. So, things that we look at in terms of hospice appropriateness might be trends that show an increasing dependence in ADLs and those activities of daily living. Changes in mobility and the person's ability to um, take themselves to the bathroom, bathe themselves. Those are things that we're looking at. We're looking at weight loss. We're looking at sometimes some labs can be supportive if we look at a serum albumin that is low. We're looking at falls. We're looking at skin integrity. A lot of those things can paint a picture of someone who is in a general decline and may be infections is another thing we look at. Someone who's had more frequent infections, that they may be entering that stage where they're more hospice appropriate. Um, One of the benefits of a palliative care approach, if you're working with your physician um, on a palliative care approach, is that the physician or the secondary caregivers may be able to see those trends, um, maybe even more clearly than the primary caregiver does, because it's difficult to see the forest through the trees sometimes. A primary caregiver, someone living with dementia, it's a stressful role to be in. It's an overwhelming role to be in. If we're considering an invasive medical procedure or diagnostic test, that part of palliative care is to have those guided discussions about if there's going to be something, a procedure that's going to be painful or require a hospital stay, which could be disorienting for your loved one. um, does that procedure, does that test, will it help benefit their quality of life, improve their quality of life? Sometimes that answer is yes, but if it's not, then why are we doing it? So it's really having those conversations, and those answers are going to be different for everyone, and these decisions are very individual.
Yeah, and I think especially as daughters, you said that, secondary caregivers could, we as daughters could be the ones that would notice those changes more than our caregiving parent. Just because we are a little like, I mean, we're geographically removed from the situation, but
Right.
also a little bit more emotionally. removed in the sense that we
Yes.
can be more objective. So, um, could you talk about maybe like say, I'm talking to my mom on the phone and she mentions something that, behavior that my dad has done that has not been the case in the past. Is there like a question that I could ask her to maybe, I know we talked in a previous conversation about pressing pause, which I love.
Yes.
Yeah.
Yes. And I think that's a really important point to emphasize. When people who are living with dementia have behavior changes, changes in behavior, a lot of times, that dealing with that change is stressful. Some doctors will even jump to using a medication, maybe even a psychotropic medication, to address that behavior, kind of as a first line. And when we are really looking at someone's care through a palliative lens, we need to dig a little bit deeper. So that pressing pause is okay. Instead of saying this is the dementia causing this behavior, we need to look at, is there an underlying infection? I don't know if you've ever had a urinary tract infection, but bladder spasms, feeling like you have to urinate and you can't, those feelings for somebody who has some aphasia or isn't able to communicate clearly what they're feeling, can result in behavior changes. Mouth pain can make someone not eat. And instead of saying, well, they're not eating because they have dementia, there may be a reason. Pain assessment, this is a huge one. Sometimes the first sign of pain in someone with dementia is a behavior change. So if we don't dig a little bit deeper to find that root cause, constipation is another big one that can cause behavior changes. So we really need to press pause when the stress of that behavior is happening, and really start digging around to find what some potential underlying causes might be, and maybe bring your medical team in to help you sort that out before rushing to use a psychotropic medication to treat a behavior, because a lot of times it's avoidable.
Yeah. Can you give an example of a psychotropic medication that's
Yeah, so a psychotropic medication is just something that changes, impacts the body by working in the brain. So lorazepam is a benzodiazepine that is commonly prescribed, and it's sedating. And it works. It works great for anxiety too. However, it also can cause paradoxical reactions. Somebody can actually make somebody more agitated. It can make someone more at risk for falls. It's a useful tool, and it's not a bad drug, but it just should be used appropriately and not prematurely. Another medication I see, the atypical antipsychotics are sometimes prescribed for people with dementia. So a Seroquel would be an example of that. Again, to treat agitation. But if the root cause of the agitation is constipation, then the Seroquel is just going to be sedating. It's not, and again, can cause side effects.
right? Other
So,
side effects, and then you never
right,
really get to the root cause of the issue.
right, right. So,
Yeah.
again, those medications, I'm not anti medication, and medications can be useful tools, and they can be very useful tools with a palliative care approach. If we are treating symptoms of discomfort, medications can be a very powerful part of that. But we should always explore underlying cause of changes in behavior or symptoms for people with dementia first.
Yeah, and so a way I know, for my mom, when I would have phone conversations and notice a change in behavior, I would ask, hey mom, that's interesting. How long has this been going on?
Mhm.
Or has have you have a chance to bring dad to the doctor to ask about that? I think again, since we are not with it every day, we could notice the differences. I think it's easier for us to see that. So I think those are really good
Yeah,
questions.
I'm a big fan of journaling too.
Yeah.
Yeah,
Yeah.
yeah. Encouraging a loved one to keep a journal, because if you have someone, I know for me, if I'm under stress, I'm only as good as the last 5 minutes, right? If things have been bad for the last 5 minutes, and my emotional self think they've been bad for the last month and a half, right? So it's
Right.
good to have some data to work with so that you can see that objective side of the picture when you're
Yeah,
under stress.
absolutely. I think when you're in survival mode, you're right. Like you're just functioning in the last 2 seconds. And I mean,
Yeah.
that is realistically how, your caregiving parent is running. And that's totally understandable because, they're trying to help their person with the dementia survive and themselves survive, right? So they're not going to be looking to see like, what's the overall pattern here. So that's how I think that we can be helpful. I know you mentioned a little bit about advanced care plan. Can you talk a little bit about what that is and why that's important?
And I would argue that that's probably one of the most, if not the most important piece of um, of a plan, of a palliative care plan. When someone is has a new dementia diagnosis, they are seeing all of their power kind of crumble away. And when you make decisions about what you want to happen, when you can no longer make those decisions, you have the power and the time to do it now. I have found with the people I've worked with that it's been a very empowering experience, that they can use their voice while they can.
Mhm.
It's also a tremendous burden lifted from a primary caregiver and carrying out decisions that have already been made, and that makes a huge difference. So when we look at advanced care planning, the one that people are most familiar with is a DNR, a do not resuscitate. So if someone stops breathing, if their heart stops, do they want CPR? Do they want defibrillation? Do they want medication to try to restart their heart? Um, and it's important to know how you feel about that decision, and to document it. But there are so many other things to consider. Whether someone wants to be hospitalized or not, you know at what point would you prefer not to be hospitalized and prefer to be cared for at home? There is, especially in the case of dementia and stage dementia, there is you know almost anything that would need to be done to enhance someone's comfort can be managed in the home. It is only in very rare circumstances that we would need to transfer someone if that's not what they wanted. And what you know about dementia is that keeping routines, keeping familiar spaces, familiar people, is so critical to someone's comfort. It's hard to imagine how you could do that in a hospital room. So most people want to be at home. Um, Other things to consider: feeding tubes, you know, ventilation, supported breathing. There are all of these. Use of antibiotics is another one that people have different feelings about. So I really encourage families to start these conversations. Social workers and nurses, certainly members of a palliative care team. If you have palliative care involved in your care, those nurse practitioners, physicians, members of that team can help facilitate those conversations. And it's not just one conversation; it's an ongoing conversation. But it is, once those decisions have been made, you get to carry on with living life. And, as you say, Laura, finding the joy in dementia. You have more time, more energy, more space to focus on the joy when those decisions, when you've taken the time to reflect on your personal values, what you want, and have shared that with your loved ones.
Yeah, and I think you bring up a good point that, it's so much to deal with as a daughter and also a spouse of someone with dementia if they never specified their wishes. because you have, the grief already. I mean, I guess for dementia, it's, you always have that anticipated grief because you know that they're going to pass since dementia is terminal, and it doesn't have a cure at this point. But also, like, just the difficulty, I guess, in having to figure out, like, okay, well, what would, in my case, dad would have wanted, and I have to answer all these questions about feeding tubes and DNR and all that stuff, and you have this guilt because if you don't make the right decision, then maybe that's not what they would have wanted, and so this just completely gets rid of all that stress, at in those stages, and it just prepares you so well, I think. And that is actually one of the things that I did when my dad was first diagnosed, where we really updated both of my parents' wills. And I thought that was, the best thing to do. And I actually mentioned that in my very first video on this channel. That is one of the most important things to do. So I'm so glad that you agree with that, Heather. And I think the last thing is we talked about briefly, um, picking out a doctor to work with after the diagnosis is made, whether that's, a neurologist or, is it the family doctor? Do they have the training? Can you speak a little bit about that?
Yeah, so I think that there are a lot of different paths to that, but I think one thing to consider is your family doctor may or may not be the right provider to continue to follow someone after they have a dementia diagnosis. Um, there are some family doctors that do have that expertise, are up on the current research and treatments, you know, do understand dementia and what, not just that, but for that individual, but for their family. The connection with resources, can they really support the whole family through that dementia journey? So it's important to ask those questions and not to feel bad if you do need to separate from your family doctor because maybe they're not equipped to help you through that journey. A neurologist, some neurologists are very skilled at treating dementia. Some of them have great bedside manner too. You don't often get both, in my experience. So if you're lucky enough to find an excellent skilled neurologist with a lot of experience and up to date on the current research, and also you feel good when you leave their office, that's great. If not, working with a geriatric nurse practitioner or a geriatrician. The other thing you can do is you can have your family doctor and you can also layer in an advanced illness management team or a palliative care team. You'll find out in the community advanced illness management, AIM, is a common phrase that is used for a program that is essentially a palliative care program. So here in Virginia, there are some companies that do that where they will have a nurse practitioner who or a physician who have palliative care expertise come to the home to provide palliative care services with a team. And so, you may be able to layer in that expertise along with your family physician. So there's a lot of different options.
That is really helpful. And I honestly wish that I knew the difference between palliative care, that it was an approach versus
Mm.
hospice, because I think, my family definitely would have taken advantage of that if I had known that it was available. So thank you so much for sharing that with us, Heather. And let's see. So, so we're getting towards the end. So if you had to sum up this interview to one takeaway point that's specific to long distance daughters who are also secondary caregivers, what would it be?
So it's hard to pick just one because there is so much about palliative care and a palliative care approach that is very important to me when working with people living with dementia. But I think for secondary caregivers, it's this idea of what I call the test, and the test is the question: does this decision that needs to be made about a medication, about a procedure, about a move, whatever that important decision that we're making, does it improve your loved one's quality of life? If the answer is no, it doesn't, then it's okay to pass on that decision. Um, I think that's the most important thing is to keep quality of life, the relief of suffering, at the center of every decision that we make.
Yeah, and then it's okay to say. So Heather is saying this very nicely, that it's okay to pass on the decision, but she really means saying no. So I think I think sometimes in my case, I think I was more comfortable saying no than my mom was to certain
Yes.
things. And so I think that is a way that we can be helpful. And I wanted to add to that too, just coming from the daughter's perspective. We talked earlier about finding, a geriatrician or a geriatric nurse practitioner who, ideally has good bedside manner, but also is up to date on the research for dementia, and is knows what's going on and what to look for. So I really think that that is the role that the daughter can play. We have very much experience researching restaurants that we want to eat at and reading, 45 reviews. We also have more time that is available for us. So even though whether we have kids or we have fur kids in my case, yeah, we have full-time jobs and everything, but honestly, we're not living with the person with dementia. And so we really do have more time than our parents do to look at that. And so what I would recommend is, maybe coming up with three ideal doctors and, bringing them to your caregiving parent and saying, in my case, hey mom, I found these doctors and I think it looks like from the reviews they have a lot of experience working with patients with dementia. And I was thinking maybe, in the case of my mom, she didn't want to switch from their family doctor, and so they kept seeing the family doctor. But then they also layered in, as you were talking about, Heather. They did a layering in of this new doctor who is up to date on the research that I also felt comfortable with. So there's always a compromise to be made, but I think again, that's why I started this channel, because I really feel like daughters can do that legwork on behalf of their parent, both their parents actually. And I think too, just have the conversation about, hey dad, what do you want in the future? Now that you have this diagnosis, I want to make sure that, mom and I are making the right decisions for you and what you would want. And I think it's one of those things, and Heather, I'm sure you'll agree, it's one of those things that you dread having. And, because no one wants to talk about death, but then once you have it, you just feel uplifted, like something has been lifted off of your shoulders. And I know that that's how I felt when I had the conversation with my parents. And yeah, so I think that that is super important too, if you're going to take anything away from this conversation. Um, so thank you so much for being on Joy in Dementia, Heather. And where can we find you? Do you have a website or an email?
Yeah, so my website is pathwaysinaging.com. I do write a blog there, and you can find more information about our services. I would also recommend aginglifecare.org, is the website for the Aging Life Care Association, the professional association, where you can find more information about the role of care managers, the ethical code that we adhere to, and also find someone in your area to work with if you do need help coordinating care, help finding a doctor, help with resources in your community to support your loved one.
That's awesome, Heather. Thanks for mentioning that because I know I do have some viewers that are outside the DC area, of course. And I think we even have some international viewers. So, I would just say we have something in the US called the Area Agencies on Aging that are in each location. And I think Canada has something similar. Definitely check out the website the two websites that Heather mentioned. And I will put those in the description below. And awesome. Well, thank you so much, Heather, for joining us and talking with us about this really important topic.
Thank you, Laura. Take care.
You too. And thank you so much for tuning in to my channel. And I would love it if you could subscribe and watch some more videos. We'll have another guest expert next month. So I hope to see you then. Bye.